Okay, so let's have a look at some exam questions based on what we just said about preventing disease spread and disease control. So public health based. And we're going to look through one absolutely typical question which came up on the GCSE a number of years ago. This is to do with a guy called Semmelweis in the 1800s who looked at death rates after giving birth. Now, of course, he wasn't aware that what he was actually looking at was infectious disease, but that's exactly what he was looking at. He noted that sometimes after giving birth, women got a high fever and died as a result. And what actually they were looking at there was sepsis, was bacterial infection. Okay, so he did some public health work, and here is a question about what he found out. So it says here, in the 1800s, many women died from disease after giving birth. Dr. Semmelweis compared the disease rates in women in two hospital wards, Ward A and Ward B. Okay, so table 1 shows some of their results. So you've got the year down the left hand side, and you've got the two different wards here, percentage of women who died here. So you've got basically up to 11.3% of women dying. So a 1 in 10 chance, slightly more than a 1 in 10 chance. That's a pretty high chance. Now you can see there's a change in the data here as is listed. Before 1840, doctors and nurses worked in Ward A and Ward B. Okay. The doctors often worked in other wards with patients who had diseases, and the doctors did not wash their hands. I know it seems absolutely ridiculous now, but that was the case. And quite often these doctors would be coming from the morgue where they were completing autopsies, and they wouldn't change their gowns, they wouldn't wash their hands, they would go literally straight from dealing with bodies who died from various infectious diseases or anything else and come straight into the maternity ward. Okay. So in Ward A and Ward B, the doctors often worked in other wards, didn't wash their hands, so on and so forth. After 1840, doctors only worked in Ward A and not Ward B. So Ward B was an early nurse-led unit, a midwife-led unit, which didn't have the doctors coming from other wards. Okay, so only nurses worked in Ward B, and the nurses did not work in other wards with patients who had diseases. So we've been told that before and after 1940, so there's a big change between these two dates here. So what I want you to do is have a go at these questions. Pause the video in just a moment. We'll read the questions through together. We'll identify what it is they're asking and see if you can answer the questions. So look at the data for Ward A and Ward B after 1840. Describe the effect on death rate of having only nurses working in Ward B and not doctors. And to gain full marks, you must refer to the data in Table 1. So, two things there. Your command word is describe, so there is no need for you to use the word because. If you use the word because, you're doing an explain question. You're doing that wrong. That's the next question down here. Describe is literally say what happened. Okay? And it says there, to gain full marks, you must refer to the data in Table 1. So it's a 2-mark question. So that quite clearly tells you you're going to get 1 mark for stating what happened and 1 mark for some data to back it up. Okay. The next question suggests an explanation for the difference you described in part AI. So whatever you said here, this is where you do use your own knowledge and the word because. So when it says explain, you are expected to use your own knowledge. Okay. So there's 4 marks worth of questions there. That should take you 4 minutes. So pause the video now. Done that? Finished? Okay, and we can look at some mark schemes. So, as we can see in the data here, look, right, it says in Ward B, so if you talked about Ward A, you weren't reading the question, you might have read it to you. So we're looking at the difference before and after 1840. So the difference clearly is there's a big decrease. Okay, so when you kick the doctors out, there's a big decrease. 7.8% of women dying down to 2.1. Okay, so roughly 8% to roughly 2%. Okay, that is a big difference, a quarter of the death rate. Okay, that's good work, right? So we've obviously got a mark there for a decrease in the death rate. Okay, and what's the data? Well, you would state 7.8 down to 2.1, and that's your other mark. And then suggesting an explanation for the differences you described in A part I were all the things we've talked about in the previous lessons. The doctors wouldn't be bringing in various pathogenic organisms, and I want to be very specific about the mark scheme here. Look, so lower percentage of women dying is 1 mark, and a numerical reference to a pair of figures to show this. Any reference that shows what you were talking about is fine. Now, doctors were not transferring the disease, is what you want to say. It says ignore reference to nurses because the difference is not the nurses. Okay? We said the nurses weren't transferring diseases around. That's not correct. The difference is the doctors. Next one then, acceptable terms, pathogens, bacteria, viruses, microbes, right, is what we want to be talking about. So the doctors were not transferring pathogens, bacteria, viruses, microorganisms, and microbes. Okay, fungi is fine, but disease, not okay. Germs, too low level, I'm afraid, and infection, again, too low level. You want GCSE level language here. So what is it those doctors were bringing? You now know, from your perspective, it's a pathogen, which could be a bacteria, a virus, general term being microorganisms and microbes is okay. Fungi is acceptable, although it's unlikely to be fungal infections that are killing them. Could be, but virus and bacteria far more likely. Okay? Right, that's your 4 marks for that one. Next one then. So in 1847, Dr. Semmelweis told the doctors to wash their hands before they began to work in Ward A. So it seems very sensible now, but this was genuinely revolutionary. And he would put out buckets of chlorinated water, so like very, very strong swimming pool water kind of arrangement for them to wash their hands in. So Dr. Semmelweis, so table 2 shows the death rates in the 2 wards after 1847. Dr. Semmelweis was right to tell the doctors to wash their hands. What evidence is there to support Dr. Semmelweis telling the doctors to wash their hands? Use information in table 1 and table 2 in your answer. So you're getting clear instructions of what you need to do there. You're being told the answer, that he was right. The question is, what is the evidence? So this is a 3-mark question. You need to put 3 marks worth of evidence. And it says use table 1 and table 2. So to get 4 marks, you need to do something from both tables. Okay? And the second part, in modern hospitals, less than 0.1% of women die from disease after giving birth. Medical understanding obviously has improved since the 1850s to reduce the death rates. Other than improvements in hygiene, you wouldn't believe the amount of people who've written hygiene's better, even though in the question it says other than that, so don't write that. Give 2 reasons for the low death rate from infectious diseases in modern hospitals. So you've got a 3-marker and a 2-marker, so that's 5 in total. So take 5 minutes if you need to. Pause the video and have a go now. Done that? You sure? Okay. So let's look at table 2. So we've got so table 2 shows a death rate in 2 wards after 1847. As you can see, look, this ward here, Ward A, where if we remember, it was very, very high here, okay, where our doctors are working, has suddenly dropped down. Right, so that's a key point. We've got a drop in the death rate to pretty similar to the nurses' ward. Now, obviously, we're telling the doctors to wash their hands, telling everyone to wash their hands, which brings that in line, right, with the nurses. Now, the nurses one's still dropping, so the nurses obviously could still benefit from washing their hands, okay? But we've got a drop down in the levels, right? Quote the figures, right, to roughly the same as the nurses, okay? So in that case, the numbers we might quote would be from 11.3% in the doctor-led ward in 1846 to 2.7 in 1848. A drastic improvement. Okay, and the next one here, other than improvements in hygiene, 2 reasons for the low death rate from infectious disease in modern hospitals. Well, here's the mark schemes. So your first ones, your 3 marks there, lower percentage of patients dying when the doctors wash their hands. Obviously, that's just stating what happens. Large decrease or reference to proportional data. So it went down is important. There's little or no difference between A and B now. So the doctor-led ward and the nurse-led ward are about the same. And there's a continued drop in Ward A. So it drops and then it continues to go down, which is marvellous. Now our answers for part C. We've got a better understanding or knowledge of immunity. So if you did any reference to immunisation or vaccination as we talked about, that is worth a mark. Better or new drugs. Okay, so you can have antibiotics, penicillin, new medicines. It's a bit general, but it's saying allow it there. And then, of course, sterilisation of equipment. It's not just about washing hands, it's about washing tools as well. So sterilisation of equipment, isolation of patients, which we've talked about in this lesson, you can have that as well. Some infectious diseases are wiped out, right? So we're talking about vaccination wiping out things like tuberculosis, smallpox, and all that kind of stuff from the country. So you can have that. Or earlier identification and treatment of infections. Now, it does say there, because it said it in the question, ignore references to general hygiene. Okay? And that is a typical question you can expect on this topic. So I hope that was helpful to do that together. There'll be some other practice ones coming your way. Enjoy. I'll see you soon.